morning, sir. I am Kristine Gumboc from Medical Colleges of Northern Philippines. Sir, can you please state your name and your birthday for me to confirm that I have the right patient in front of me?
My name is James Trinidad,
And your birthday, sir?
May 5, 2004, ma'am.
Okay. Sir, how would you like me to address you po?
You can call me James.
Okay, Sir James, today I am going to assess your nail, skin, and hair for me to have a insight into your current health status. Is that okay with you, sir?
Okay.
Sir, throughout the assessment, I am going to touch a certain part of your body. Yeah, is that okay with you, sir?
Okay lang po.
Okay, so if you have any other questions regarding on what I said, you can ask me. Do you have any other questions, sir? Okay. Next, we are going to put a examination gown to the patient. Next, we are going to perform hand hygiene. Okay. So, the first procedure is we are going to inspect the overall skin coloration of the patient. And sir, can you please raise your hand like this? And we are going to expose only the certain part that we are going to inspect. Okay, so we are going to inspect the patient's skin coloration. Okay, sir, your skin color ranges from light brown to deep brown, sir, and that's normal. And after that, we are going to inspect for the signs of vascularity, bleeding, or any bruising. So, we are going to inspect. Sir, your skin does not have a vascularity or any signs of bleeding and bruising, and that's normal. And then after that, we are going to inspect for any lesions. Okay, so the skin of the patient has no presence of lesions such as skin bites or bruise and other skin lesions. And then next, okay, sir, we are going to palpate the patient's skin for his temperature using the back of our hands. Sir, is it okay that I am going to touch your face using the back of my hand? Okay. Okay, the patient's temperature is normal, and after that we are going to palpate for the texture and moisture of the patient's skin. Sir, can you please raise your hand like this again? Okay. Okay, the patient's skin is dry and smooth, and that's normal. Next, we are going to assess the patient's skin trigger by pinching the under the clavicle of the patient. And by doing this, we are going to expose only the certain part that we are going to assess the skin trigger of the patient, which is the under the clavicle of the patient. Then we are going to pinch. Okay, after pinching the patient's skin, it goes back to normal. And then after that, we are going to palpate for the patient's foot for any signs of edema. Okay, sir, is it okay if you raise your foot? And then we are going to expose only the part we are going to pinch the patient's skin. Then we are going to put pressure on the patient's skin. Okay, sir. Okay. The patient's skin is normal since after releasing my hand, the patient's skin it goes back to its normal position or face. Then, thank you, sir. So after that, we are going to inspect the patient's nail angle. Sir, place your hand like that. Okay, the patient's nail is normal and there is no signs of clubbing. Next, we are going to palpate for the patient's nail texture and capillary refill. Okay, thank you, sir. Okay, the patient's nail color goes back to normal after pinching it, and that's a good sign. And then last, we are going to inspect the patient's hair and scalp. Okay, please. By doing this procedure, we are going to put on a gloves for the patient's safety and the worker. Okay, sir. Is it okay if I touch your hair and scalp, sir? Okay. Okay, so the patient's hair scalp is normal since there are no signs of infestation such as lice. There are no signs of scars or any lesions. And of course, the patient's hair is normal since the hair distribution of the patient is normal and thick. And after that, we are going to dispose the gloves. Do a proper disposal. And then we are going to perform hand hygiene. And then we are done with the assessment of the patient's integumentary.